Alright, so now let's study about problems which can occur with the eyelids. Now, eyelids are the protective covering of the lids, and if you draw a cross section through the eyes, you'll see that the eyelids can be divided into an interior and a posterior portion. So if this is the eyelid, and this is the eyeball, this is the lower eyelid, and this is the hairs on the eyelids, that is the eyelashes. Now you can divide the eyelids into an interior portion and the posterior portion. And they can be pathologies which are associated with both of these, that is the interior portion and the posterior portion. Now, if you study the basic anatomy of the eyelids, well, the interior portion of the eyes basically contains only one structure, that is the eyelashes. And the posterior portion of the eyelids have something called tarsus plate. And embedded in the tarsus plate, you have meibomian glands. And the meibomian glands are connected to one another, and they have pores at the base of the eyelid, which leads to the secretion of the oily portion of the eye film. So meibomian glands serve to produce the oil content in the tear film. Now, they can be pathologies associated with the interior portion of the eyelid and the posterior portion of the eyelid. So let's study each of them one by one. So in the interior portion of the eyelid, you have eyelashes. So the problems are expected to be due to the eyelashes. Now, the hair on the eyelids, that is the eyelashes, are no different from the hairs on the rest of the body. And the hairs have a basic structure. You have this portion of the skin, then you have the hair, and associated with the hair lying in the dermis, you have sweat glands and the sebaceous glands. These are also located in the eyelashes. So if you have sweat glands and you have sebaceous glands, excuse me. So you have sweat glands and you have sebaceous glands, and there can be inflammation of the eyelids that leads to pathologies. Now, one of these is called blepharitis. Now, blepharitis basically literally means inflammation of the eyelid. So you can have interior blepharitis, which is nothing but the inflammation of the eyelashes, and when the eyelashes get inflamed, get inflamed, it leads to deposition of scales at the base of the eyelid. So it leads to the colorate formation. Colorate formation are nothing but the scales on at the base of the eyelashes. And these can be due to various pathologies, the most important of which are the staphylococcal pathologies. That is, there is scaling due to the staphylococcal growth, or they can be due to fungus, which is seborrheic dermatitis. Now, seborrheic dermatitis is nothing but dandruff. So you can think of it as dandruff of the eyelashes, so it leads to white-colored scales. Now, scales due to any cause, whether it's staphylococcus or seborrheic dermatitis, can fall off and irritate the eye just beneath it. So it can lead to symptoms like red eye, irritation, grittiness, because the colorates irritate the eye. Also, if the blepharitis persists for a very long time, it can lead to inflammation of the eyelashes, and the eyelashes can change directions, and the eyelashes can actually turn inwards and face the eyelid and face the eye, the globe of the eye, and that can lead to prolonged irritation. And if the eyelashes are turned inwards, it can lead to scarring of the cornea and the conjunctiva, and it can lead to things like keratitis. Also, if the eyelashes are inflamed for a very long period of time, they can lose their color, which is called poliosis. So it can lead to a color change of the eye, which is called as poliosis, and it can lead to chronic inflammation of the globe of the eye, conjunctivitis, or keratitis. Now, another thing you can see with the eyelashes is something called hordeolum. Now, hordeolums again can be divided into interior and posterior hordeolums, and since we are discussing the pathologies of the interior portion of the eyelid, we are going to discuss about hordeolums. We are going to discuss about external hordeolums. So, hordeolum. Now, hordeolums are nothing but abscesses of the hair follicles. So again, hair follicles are associated with sweat and sebaceous glands. So there's sweat and sebaceous glands, and inflammation of these sweat glands or sebaceous glands can lead to hordeolums. And another name for hordeolums are styes. So it is actually pimples of the eyelid. And the pathology of the pimples is that there is a hair follicle, and the sebaceous glands, which lies at the end of the follicles, can get clogged, and that can lead to kind of a small abscess formation, which is called pimple. And the similar pathologies when happens in the eyelids are called hordeolums. So hordeolums are nothing but a swelling of the sebaceous glands or the sweat glands, which can lead to an inflamed eye at the margin of the eyelid. So these are the hordeolums, which are abscesses of the hair follicles. Now, these are the two basic pathologies associated with the interior portion of the eyelid. That is blepharitis, which is an inflammation of the base of the eyelashes, and hordeolums, which are inflamed sweat or sebaceous glands in the eyelid. So basically, both of them involve single pathology, that is inflammation of the hair follicle complex. Now, another thing we should talk about is the posterior portion of the eyelid. Now, posterior portion of the eyelid contains, as we just discussed, meibomian glands, and all of the pathologies of the posterior eyelid revolve around the meibomian glands. Now, we have three pathologies which are associated with the meibomian glands. They are posterior blepharitis. Because there was an interior blepharitis. There is internal hordeolums, analogous to the external hordeolums we just discussed, internal hordeolums, and then you can have a pathology which is called as Chalazion. Now let's discuss each of them one by one. Now, we've studied the function of the meibomian glands is to produce lipids, that is the fat content of the eyelid, of the tear film. Now, there can be a dysfunction of the meibomian glands, such as they can't entirely empty to the tear film, such that there is retention of the lipids inside the meibomian glands, which leads to a swelling of the meibomian glands. So this is virtually what we call posterior blepharitis. So in the posterior blepharitis, there's intrinsic dysfunction of the meibomian glands, such that the glands cannot fully empty, and that leads to swollen meibomian glands. And how do they present? Well, if you consider this is the eyelid, and behind the eyelid there are swollen meibomian glands. So when you evert the eyelid, you can see swollen meibomian glands, clearly swollen meibomian glands. So this leads to posterior blepharitis. Now another thing is internal hordeolums. Now, in internal hordeolums, there is an acute obstruction to the meibomian glands to do anything. So when there is an acute obstruction to the meibomian glands, there is acute accumulation of the lipids, and that lipids can break down to produce fatty acids, and this leads to inflamed meibomian glands. This is called as meibominitis, that is an inflammation of the meibomian glands, and this is an acutely very painful condition. Posterior blepharitis is kind of an irritative process. There can be some amount of pain, redness, but internal hordeolums are acutely painful. And such they usually present like external hordeolums, that is, they are acutely abscesses. So both internal and external hordeolums are abscesses, usually due to staphylococcus, but they can also be sterile, staphylococcus. Now, lastly, we have to discuss about something called Chalazion. Now, Chalazion is also an inflammation of the meibomian glands, but it is a chronic inflammation. That is, the acute processes settle down, and it leads to a granulomatous change or a granulomatous reaction around the meibomian glands, which leads to a painless. That's the key word: painless swelling of the meibomian glands. So, an internal hordeolum, after the inflammation has settled down, can convert into a Chalazion. So, if we summarize, in the posterior eyelid, we have everything related to the meibomian glands. If it leads to an intrinsic dysfunction of the meibomian glands, such that the meibomian glands are swollen but not very painful, it's called posterior blepharitis. If it leads to an abscess formation, such that the eyelid is grossly inflamed, it leads to internal hordeolum. And if the process has settled down and we see a granulomatous reaction around the meibomian glands, it is called as Chalazion. Now, what's the treatment of each of these? Well, if you consider blepharitis, whether it is anterior blepharitis or posterior blepharitis, the principles of treatment are same. Blepharitis. The principles are actually just the same. That you have to maintain the lid hygiene, because you have to remove those colloids in the anterior blepharitis. And how do you remove that colloids? Well, you can use baby shampoos with some dilution, or you can apply warm compresses which can break off those colloids from break off that sticky colloids from the eyelids, because the colloids are kind of sticky and you have to kind of warm them or melt them such that they fall off easily from the eyelashes. Now, if you're considering posterior blepharitis, well, the problem was with the meibomian glands, such that the meibomian glands could not fully empty themselves. So what you do in this case is that you apply warm compresses. So when the meibomian glands are heated up, it leads to melting of the fat content, and then you, immediately after applying the warm compresses, you give eyelid massage. When you massage the eyelids, the liquefied fat just exudates out of the meibomian glands, and the processes settle down. So this is the management of the blepharitis. Lid hygiene, maintain the lid hygiene, and if you see those swollen meibomian glands, apply warm compresses, and then do a lid massage. Now, this was the anterior blepharitis. If you're considering hordeolums, the treatment of the hordeolums is pretty easy. The treatment for both the external hordeolums and the internal hordeolums is kind of similar. Usually, you don't have to do anything. Over a period of several days, the hordeolum or the styes settle down on their own. However, if they don't settle down and you see those inflamed meibomian glands, you can again use warm compresses followed by lid massage, which facilitates the emptying of the meibomian glands. And if the meibomian gland inflammation doesn't settle down in 1 to 2 weeks, you can refer the patient to ophthalmologist, who will do an incision and drainage of these meibomian glands. Now, if you're talking about chalazions, Well, chalazions also resolve on their own. So if you have a small chalazion, it'll resolve on its own. If it's a very large chalazion, you can use the same principles. Warm compresses followed by lid massage, which leads to emptying of the meibomian glands. And if it's very refractory, you can refer the patient to the ophthalmologist who will do an incision and curettage. You will do an incision and curettage. Incise the meibomian glands and curettage the entire meibomian glands so that it doesn't recur. So if you summarize the treatment for blepharitis, anterior or posterior, do lid massage, maintain lid hygiene, do lid massage and warm compresses if required. For the abscesses, that is the hordeolums, for both interior and posterior, apply warm compresses and lid massage. If it doesn't resolve, you may require incision drainage. And for chalazion, again, they can resolve on their own, but if they don't resolve, do incision and curettage.